on 9 on your side is actually giving you a rare opportunity here to hear straight from Vice President Mike Pence about what actions he and the president want to see happen as it all relates to health care.
Vice President Mike Pence is joining us live tonight from the Eisenhower Executive Office building in the Capitol. Thank you for joining us, Mr. Vice President.
Oh, it's an honor to be with you. Thanks for having me on.
You bet. You are very familiar with the heroin epidemic in the tri-state. How can you ease concerns in Kentucky, Ohio, and your home state of Indiana that changes potentially coming to health care will help get us out of this crisis?
Well, I missed the first part of your question with a satellite break, but if you're referring to the issue of opiate abuse across the heartland of America, I can tell you that help is on the way in the legislation that the Senate will take up next week. When I was governor of the state of Indiana, we had no higher priority than confronting the scourge of opiate abuse and addiction, and I'm pleased to report that thanks to some very good work by Senator Rob Portman and several of his colleagues in the Senate, the legislation that will give America a fresh start on health care, that will repeal and replace Obamacare, will also include unprecedented resources for states like Ohio to combat opiate abuse and addiction. But it all just depends on whether the Senate is willing to take a vote on Tuesday and start the debate over the efforts to repeal and replace Obamacare. And here at the White House, President Trump and I believe that it's time for the Senate to step up. We've seen the way Obamacare has impacted working families and businesses all across Ohio, all across the heartland. Premiums risen by more than 75% here in Ohio. We think the time is now for the Senate to step forward, begin the debate, and ultimately send to the President's desk legislation that'll repeal and replace Obamacare, rescue the people of the Buckeye State from its failed policies, and give states all new resources to combat opiate abuse and addiction.
Well, Mr. Vice President, we've seen 1.0, we've seen 2.0, we've seen Republicans not in support of either of those options. Are we talking repeal and replace, like the campaign spoke about, or just repeal? Senators Rob Portman and Rand Paul said things this week that put them in different camps on all of this. So with all the viewpoints out there, can you really make good on President Trump's campaign promise in just 6 months' time?
Well, I believe we can, but it's time for the Senate to do their job. The House of Representatives worked hard and labored through a process to produce legislation that would rescue the American people from the collapsing failure of Obamacare. I mean, we all remember the promises of Obamacare. They said health insurance premiums would go down. They've gone up here in Ohio and in Kentucky and all across the country. In some states by 100 and 200%. They promised us if you could like your doctor, you could keep them. If you like your plan, you can keep it. None of that's worked out to be true. The legislation that's moving through the Senate now would really rescue the American people from these failed policies, lower premiums, but also give states like Ohio and Kentucky unheard of, unprecedented flexibility to reform Medicaid to meet the needs of its most vulnerable. But again, it's in the hands of the Senate now, and we have to see the Senate be willing to step up and vote to begin this debate on Tuesday. And if they do that, the President and I believe we can bring the Senate together, bring the Congress together, and give the American people a fresh start on health care in this country.
So you're saying bipartisan. It needs to be bipartisan.
Well, I really wish it was bipartisan, but the simple truth is that the Democrats in the House and Senate who gave us the disastrous policies of Obamacare have refused to lift a finger to rescue the American people from the rising premiums, from the dramatic loss of coverage, from the impact that the taxes and the mandates have had on businesses and families all across the country. So the Republicans have had to do this on their own. We got it passed out of the House of Representatives. But your viewers should know across Kentucky, across Ohio, and really all across the heartland that this coming week the Senate has a historic opportunity to begin the debate to repeal and replace Obamacare. And we're urging senators in both parties to step forward. Let's start the debate, and let's give the American people a fresh start to repeal and replace Obamacare and give the American people the kind of health care reform that will lower the cost of health insurance and give states all new flexibility to reform Medicaid for our most vulnerable.
Vice President Mike Pence, thank you so much for joining us today. I know we only had a short time to have this discussion today. We certainly appreciate your time and look forward to following the vote next week.
Yes, all eyes are going to be in Congress next week.
Absolutely. In fact, Senator Mitch McConnell's team has confirmed that there will be a vote next week to repeal the Affordable Care Act. They say they will begin with a vote to proceed to the House bill to amendment. We, of course, are going to follow any new developments on this issue over the weekend and into next week.
And, of course, on 9 on Your Side at 7, so we hope you'll join us then.